Well, hi, welcome to the podcast. We're joined today, coming to us from the Netherlands, Arnout Orelio. He has a background very similar to my own, and I think we have a lot of shared experiences and perspectives. His career has progressed like mine. He's evolved from engineer to manager to consultant. He started in the auto industry and has ended up working in healthcare. Is that a fair assessment of your background, Arno?
Yeah, I would say, yeah. And I made a side step to project management.
Okay. And part of the progression, and by the way, thank you for being here on the podcast. I got a little bit out of my standard work.
No worries. Thank you for having me.
Yeah, I'm really glad we could do this. And Arno and I have crossed paths actually in person when I've had opportunities to go to the Netherlands for different healthcare events. And I forget, did you ever come to the US for any conferences where we've crossed paths or only in the...
Yes, there was a time when I organized study missions to the US, and I visited quite some episodes of the Lean Healthcare Summits.
Yeah.
And I believe there was one where you were the master of ceremonies. So,
right. Yeah.
Okay.
Yeah, so that might have been 8 or 9 years ago. So we've talked and crossed paths a lot over the past decade.
Yeah, we did.
One other similarity, Arno has also become an author. So two books, first off, written in Dutch. Is that right?
Yeah, correct. Yeah. So the first one was published in 2019 in September. And then last year, 2020, I launched my second book in Dutch in June. And the translation of that book came out this September in 2020. Yeah, exactly that.
And for those watching, for those listening, you don't see me, as the YouTube viewers will see, holding up a copy of the book. I was able to buy it from Amazon.com here in the States. And it is titled Lean Thinking for Emerging Leaders. And that's going to be the main topic of conversation today. There's so much we could talk about. Let's talk about the book, and we'll do podcasts again after this. How about that?
Yeah, that would be awesome. Thank you.
So congratulations on the book. And before we dive in and talk about the book, can you elaborate a little bit on some of your background and career path? I gave the very quick summary of it.
Yes. So as you mentioned, I'm an engineer from background. I studied mechanical engineering, but I soon found out that I had not a strong passion for technology, which is strange maybe for an engineer. But I have a passion for people who try to understand and work with technology. So I started my master's in what's called innovation sciences currently. At the time, it was called technology and society. It had all different kind of names, but the most important thing was what happens when people interact with technology. And from there, I became a production manager in the automotive industry. In the time that we have one of the first companies that is a third-party manufacturer for the automotive industry, which is quite rare in the world. And they were building Volvos and Mitsubishi on one line, which was at the time also very rare. So I was very lucky to be at this innovative point in the process. And there I found out that they found a way to increase performance of the factory fast without overburdening the people. So I felt that to be very interesting. And I had the opportunity to work with an interim manager at the time. And he showed me maybe my first lean lesson. And that's that you need mirrors, he said. He said, you need to look in the mirror every day. And what he meant is he had all these graphs and he had people with their bicycle go into the factory to gather the data, because there were no data on how many cars we made and how many were correct and first time right passes, etc. So he built a whole system and he called it his mirrors. So he said, I look in the mirror every day and see how am I doing? And I found that very intriguing. And that set off a huge improvement program, because he was like no one capable of knowing where they needed their help, or where the maintenance guys needed to go, or whatever. So he used it to steer his company. But it was at the time still a company which was strongly hierarchical, and I'm not that good with the sense that you do what your boss says just because he says so. Because I just came from university and I learned that you need to assess and you need to be methodical. But there's no time to be methodical when you need to build a car every minute. So I soon found out that no science in tech time, at least not in that factory. So, and then I became a project manager, and I discovered that people can handle a lot of responsibility. So it was a very young company, and they taught me, you have the responsibility you take. And that meant that the people who could take on a lot, and I was lucky to be somebody like that, they could grow because they get the largest projects, etc. But to me, project management was more a trick than a profession. So it didn't challenge me enough. And then I saw an ad from a lean consultancy firm. And all the words I heard, the buzzwords I heard in school and in that automotive company were in that ad. And I thought, this is what I want. I want to be a consultant, because then I never have a boss. I can talk with operators and with the CEO just as partners. And that was the best decision I ever took in my career, because I wanted to do it at the time. I thought, this is what I like. So no career planning, just in the moment deciding this is what I need to do. And then I figured out that it had nothing to do with consultancy, what they were doing, because consultants write reports and give presentations. And the only two times I did that in my career as a consultant, these were the worst projects. So what we actually did is, and that's where I learned what actual lean management is we just went to the shop floor with the responsible person, the production manager, or maybe the CEO, or whoever was hiring us to teach them this stuff. And we went to the floor and we asked the operators, what are your problems? And they always knew. And if you asked, how do you think this problem occurs? Why is that? They always knew. And if you ask, how do you think we could solve it? They also knew. So we helped these leaders to see what their work was. And that's kind of interviewing the people on the floor. What are the real problems? What are the real causes? And how can we solve them? And then, of course, the whole set of tools from Lean is helping you to give it some structure. And I made the mistake at the time to think that Lean was all these tools. But but the more I did this work, the more I found out it had nothing to do with factories. I thought it was something it had to do with factories, but it had nothing to do with factories. And as soon as I figured that out, that it's like my engineering mind already knew, it's a system. And it's a system designed to help customers get what they want. And the system is not only the technical side, but it's these people that make the system alive. So if you can figure a way out to connect everybody, then you can have great results. And because well, I'm a father of 3 sons, so I always explain that that means that you visit the hospital from time to time.
Yeah.
Yeah, because they break their arm or they break their leg, or I don't know.
Not just when they're
They hit
born, but other
no,
visits. Yes.
yeah. Not only when they're born, but
Yeah.
during. And what I discovered, and it's always a bit difficult to say, but I felt terrible when I visited hospitals, especially when I developed this lean mindset and perspective. And I thought, how is it possible that in the world that we find so important, because you're there, I'm there with my son, and I'm feeling I have pain in my stomach and I have a headache, and I cannot figure out how long it's going to take. Is there still time to go to the restroom? Are they doing the right things to my son? Is he getting better? All those things. And there was, for what I felt, no system to assure and to improve the quality of what they were doing. And then I decided, together with some colleagues of that consultancy firm, we need to tell these people about, we called it world-class performance at the time, or lean, or whatever you call it. So that became my mission. My mission became to spread this idea of that a hospital is just like a factory, a system, where the design of the system is determining the results. So please let us not blame everybody, but let's figure out a way to improve the system. And then so this is now, we're 2005, I think, for 2005. I start focusing on healthcare as a consultant. And I became a partner in that consultancy firm, and that went bankrupt in 2010.
Yeah.
So I had only one business relationship, that was with the bank at the time. But that was also good news, because now I could truly focus on my mission to help healthcare improve. And I also discovered that there's not many knobs you can turn or buttons to push. I think I found out that for me, the most important place to start is with leadership.
Right. Yeah.
And leadership is not a person, it's a process. And I felt that everybody can be a leader as long as you want to change something. So I start to specialize in, okay, how can I change the leadership mindset and behaviors of people so they start improving their process and their system, such that by doing it, they continuously improve. And maybe this is what this awareness came when I started as an independent consultant and coach. I left the consultancy approach and I became more and more a coach, because I felt it's my biggest gift to my customers is their self-reliance. If I can help them with something that they can use for the rest of their lives, then I would have the biggest impact. And that's maybe also why this book is called what it's called, to make maybe the funnel go into the book.
Right.
Because it's called Lean Thinking for Emerging Healthcare Leaders.
Yes, exactly. Yeah.
So it's about the thinking, it's about the mindset that they can use for themselves to first become themselves better, and then help their colleagues to become better, and thereby their processes, and thereby taking better care of patients. And it's called for emerging healthcare leaders, because I feel that's And that was also the reason that the American publisher, Business Expert Press, approached me. They figured that there's a gap in the market of education when it goes to healthcare professionals trying to lead. There's not much schools for them or training material, whatever. So they asked me, can you write something that these emerging leaders, so people who maybe were a doctor and now are a project leader, or an innovator, or maybe a nurse who has become the department head, or how can we help them to get started with being a good leader right away? So I tried to keep it practical. And that's why I translated my second book and not my first, because the first book is called Making People Better. And the second book is called Making People Better in Practice. So it would be the more tangible way to improve yourself. So that's how my career ended up to be an author.
Yeah. I just want to jump in and say, I mean, there are so many parallels in our backgrounds. I also got into healthcare around 2005. I also left working for others in 2010 and started working for myself. Slightly different circumstances, but the other thing I was going to say, though, just to show, I think we think so much alike, Arno. You don't see my notes. I didn't send you questions in advance, but everything that you talked about there followed exactly the questions I was going to ask. So how did you get involved into healthcare? What is an emerging leader? You made it very easy for me. I'm just sitting back and
you're welcome. I was just thinking, how am I going to fit all this in this little time we have? Because, it's always good to talk about yourself. So please slow me down if you think that I'm maybe run over the edge a bit.
No, it's okay. I mean, I'll help keep moving things along, and hey, we'll do other podcasts together, and we can take a deeper dive into some of these topics. So stepping back a little bit, though, I mean, I've had the opportunity to visit the Netherlands, maybe 5 times over the last 11 years, and I've visited a couple different hospitals and have attended some conferences. And so I've always been, quite impressed with the level of enthusiasm for lean across Dutch healthcare, and for the benefit of American listeners who don't know the differences across different European systems. We won't cover them all, but the Dutch system is not what people might think of if they're familiar with the English, the NHS.
The NHS, no.
Can you talk a little bit about how the Dutch healthcare system is structured? It's certainly not a single national organization.
No, so I will take it like 10,000 feet up, the system is that it's you would call it global payment, I guess. So, but we try to work in some way to get some market work. So market would say that there's a demand and a supply, and that we arranged by having this like you have in America. We have insurance companies,
right?
But these are not commercial. These are foundations.
They're non-profit.
So they're not allowed to make a profit, but they receive payments from their members or from their patients, and each year you get the opportunity to select your healthcare insurance company, and the differences are that they may be a bit cheaper. They maybe are not open to all hospitals, or so there's little things that differentiate them from each other. And then these insurance companies, they do the procurement of healthcare as representative for their patients. So they make contracts with hospitals and with physiotherapists and with whomever is there to provide curative care. So we have one system for the curative care, and the most important party in that system is our family or primary physician, because they're the gatekeepers of the system, but they are also, I think they're very highly trained. That means that they can filter off most of the issues of their patients. So that means that we have, well, not too many patients are forwarded to the hospital, and that's where we win a bit our costs, because we save people a visit to the hospital. So that would be the system. So I pay as a patient, I pay a monthly fee to my insurance company. My insurance company makes a contract with a hospital, and then I can visit that hospital, and my bills are paid by the insurance company.
Mm-hmm. Yeah,
that's the system in well.
Well, and I think one other difference is that individuals buy insurance. It's not from a workplace benefit.
Yeah, exactly. No, we don't have a system where the employer is the buying party. No, individuals do, and we have it's compulsory. So it's obliged by law to have insurance. And the great thing about that is that it means also, and there is which also very important, is we have a base package. So each healthcare insurance company, they are obliged by law to purchase or procure, or whatever you call it, a certain set of treatments to make sure that everything which is important and is people cannot take the risk to not insure it. There's the base package, and it's all the same throughout the insurance companies. And then there's additional things you can insure, like your eyes, like glasses or contact lenses, or physiotherapy, or things that are either not highly priced or are maybe for symptoms that are not too severe. So it would never happen that somebody is, isn't allowed to go into the ER because they hit the bus. Because it's impossible for somebody like that to not be insured for those kind of treatments. I think that's also very important to know that's the high risk indications are all insured.
Sure. So thank you for setting that context. But with the differences or similarities between, let's say, the American system and the Dutch system, or the differences between the Dutch system and the NHS England, I think the delivery of care ends up being very, very similar. So to that point, I mean, Arno, how would you describe, like, what are the most talked about, most worked on motivations for lean in Dutch hospitals?
That's interesting, because there's two streams, you could say, because the interesting thing with things like lean is they easily become the end in itself. So there's many people doing lean because their neighbors are doing lean. And we see that in healthcare, there's a strong tendency to do what other people in healthcare do. So lean is even getting a bit less attention because now we have value-based healthcare. So I think
those ideas could be combined. Yeah.
Yeah. Yes, of course. But that's only if you. That's the other stream. So there's one stream that's doing it because the neighbors are doing it, and they say, well, it's awesome. You need to do lean. But if you see what are the biggest issues why they should do lean, well, then I think the biggest issue in the Netherlands currently, as felt by the healthcare providers, is staff shortages. And especially now during the COVID pandemic, that's even more pronounced because it's, well, yeah, we have ICUs that have doubled their capacity to accommodate these COVID patients. And what's very popular in the Netherlands, when it's about parts of the lean system, then it's that idea of continuous improvement, and that's something that people on the shop floor do. Mm. So there's many hospitals that have opened their, their eyes for what nurses themselves can do to improve their work.
Yeah.
And of course, that sounds like a good idea. In itself, it's a good idea because they like it and it's better. But in my book, in my first book, I call this Happy Lean. Mm. And why do I call it that? Because the intention is to keep the people happy.
Yeah.
But it's not connected to the strategy of the hospital. Mm. So what you see is that it has great effect on the atmosphere in the wards, for instance. And yes, things get better, but it comes with little to no change in mindset and behavior of management and senior leadership. So there's another. So this is very motivating, mm-hmm. but it's also a way to keep it there. By seeing it as a bottom-up strategy, but keeping it at the bottom, that's what I see often. So
yeah, I mean, I would say that's good, but it's not fully sufficient.
Exactly. Yes.
But I think that happy lean, what you're describing, reminds me of a mutual friend and teacher of ours who just passed recently, Norman Bodek. You know, he would call it quick and easy Kaizen, just really,
yeah, exactly.
or Paul Akers, who talks about, 2-second lean, fix what bugs you. That's a great start.
Yeah. But if you don't have a system around it to have it grow, or and the problem that I sometimes see is that if it's only making people happy and better working together, but it doesn't go anywhere. So it's not always goal oriented. I mean, if you what I see a lot is, and that's maybe a bit of the danger of this strategy, is that if you improve from the current situation away, I would say, I'm not sure if that is correct English, but anyway, instead of towards a goal, then the danger is that it goes in all directions, and that in the end, the total performance didn't improve much. And that's what so it's a great start, but it's also difficult because if you have, I don't know, do you know there's a model? It's the roller coaster of emotions that you experience when you have loss. So
sure.
When you change something,
the stages of grief or something.
Yeah. Yes. So I came across somebody who changed it into the stages of emotions for change. And when you have change, it always starts with enthusiasm. Yes, we're going to do something new. Awesome. So, but many people forget that's the first stage. So as long as people are enthusiastic, you're probably not changing too much.
Mm-hmm.
So, and so if you ask what motivates people, well, this energy of enthusiasm is used a lot to motivate people. And sometimes it's even the energy of the consultant or the coach that is used to create this energy. I've been used a lot to have people get energized. Mm-hmm. But that's not what needs to change. Because nurses and doctors alike, they're already motivated to change their work. But they need to know how, and they need to be facilitated, or if they're not facilitated, well, maybe you should not be in the way, at least. But it's very important. I have learned that you direct it. Maybe to make a small sidestep to my book, that's why the first chapter is called "Give Direction."
Right.
So if you want these kind of changes, which are represented by lean management or whatever you call the new way of working, it's your job as a leader to, I call it give direction instead of like Katie Anderson calls it set direction. I took the word give because I feel that's more positive, and it says more that you're a servant. It's for you to give direction, but it's for you to give. So sometimes when I try to teach leaders that they should ask more questions, they're going to ask their team members, well, what's the goal? Yeah, but if you ask your team member what's the goal, if you don't watch out, you have 10 different goals. Mm-hmm. So no, it's not for you to ask them what's the goal. It's for you to give them direction.
Right. Yeah.
To make clear why they are a team. Because they're only a team if you give them a goal. Yeah. If you don't give them a goal, you're not a team.
Yeah, good point.
At least not in my definition. The definition that I use in the book is a team is a group of people working together towards the same goal. And it's the goal that defines the team.
Mm-hmm. Yeah.
Like you would have in basketball, where the goal is to have more points than the opponent, and you're not allowed to have more than 5. So you put 5 people in the court.
Well, you have the goal, and then there may be strategy. So, more and more basketball teams now would say the strategy is to take as many 3-point shots as you can.
Yeah.
And then it might be up to the players then to partly execute that strategy and figure out how to make that happen.
Yeah, exactly.
Yeah.
Yeah.
So, in the book, again, it's lean thinking for emerging healthcare leaders. There's a lot in there, on lean mindsets and change management. And there's 2 other things I wanted to touch on from the book that some people might think of as tools, but I think also have a lot of mindset and involved and relate to strategy in the management system. So one, of course, near and dear to my heart, which is not in most lean books, so thank you for this, is a brief discussion of process behavior charts. And thank you for including that and for kindly mentioning measures of success. But the question I wanted to ask you, Arnaud, is why do you think that's an important topic to expose people to?
Because it's all too easy. Because I was one of the people who did that. That to go from wanting to become lean or the best or whatever to start eliminating waste, because that's easy to explain and it's logical to do, but then you forget two important other problems that Toyota was solving before they start eliminating waste. And the first is overburden. So if you're overburdened, it's impossible to have a system giving you any results because it will be clogged. And then if you reduce the overburden that is needed so you can cope with variation. So, and I was taught the first course that I got when I went into this automotive company, as I recall, was statistical process control. And they had a matrix, and you should learn from the matrix that you need to have statistical stability to be able to improve the process.
Right.
So I thought, although it's very hard and it's maybe one of the more difficult subjects, I have to explain to my audience that before they go improve anything, they have to figure out whether what they're doing is stable or not.
Yeah.
And I thought, and maybe I cannot teach them all, but I need to put, and then that's the mindset thing. I have to teach them that overburden is first to be solved, and then it needs to be stable. And only when it's stable, you can improve. And that has another very important effect, because to stabilize or to figure out your whether it's stable, you get confronted with whether you have standards. Mm-hmm. Yeah. And like Taiichi Ono already said, there can be, without standards, there can be no improvement. So teaching people that a problem is nothing more or less than where you want to go and where you're now, and that the standard is nothing more than describing where you want to go or what you want to happen or that motivated me to put this in. And the great thing about it, that because I had the courage to go into this topic, which is not self-evident, this became the thickest chapter, because now I had because now I had a very good reason to teach about standardization. Whereas if you start standardization as a method on itself in healthcare, you get a lot of feedback, I would say.
Well, it can cause problems. Again, if we make, like you said earlier, we don't want, the goal is not pushing lean methods. The goal is improvement and excellence. Yes. And you don't want to push standard work without a problem.
Exactly. And we can only, the biggest problem for in healthcare to improve, that there's very little problem awareness, because the problems they are aware of are symptoms, like staff shortages. So we have to teach them what the actual problems are before we do anything else. And that's why I figured it would be helpful to put the process behavior chart in the book.
Yeah. Well, that's great. I'm glad you did. And the one other method, there's a chapter here. It was chapter 11 on job instruction, a case study, successful standardization through job instruction. And that draws on training within industry, as you write about. Why do you think that? I mean, you've already touched on it, but can you share a little bit about this, this training within industry method? People might look and say, well, that was developed during the Second World War. And I said, well, old doesn't mean it's outdated. I think the fact that it's still being used today proves how helpful it is.
Exactly. Maybe with yoga. yoga we do already for 5,000 years, so it must be good. Because otherwise we would have abandoned it already. or I don't know, in the beginning of the 19th, at the end of the 19th century, we invented the car. So shouldn't we drive cars now because they were invented 100 years ago? No, no. So the power of the trading within industries is that it has proven itself in the World War II, and the most important thing is that the method didn't change. So the method was so good that the only thing to be successful with trading with industry is following the method.
Yeah.
So, I rest my case almost. But
well, yeah.
And that has to do with the simplicity of it, and it's very easy. It's very difficult for people who don't know what it is or didn't experience it to understand how powerful it is. But it takes very little to start believing in a method. I mean, in the book, I'm not sure. Did I put a picture of myself in? I'm not sure. Well, in the book or in the case study, I'm explaining that part of the case study is that they trained me, an engineer, on a nursing task, which was I had to use a scanner to measure the blood of an unborn child. So if I would explain, well, they let me scan the blood of an unborn child, you would say they're nuts. But in 30 minutes, I could do this task flawlessly. So that was all it took for me to again understand, yes, this is so powerful. If you take this method and you standardize the right way, you can you can teach people things that they might take years to learn from experience.
Yes.
And I think that even if we could do only one thing for healthcare right now to help them with this pandemic, I would say training within industries. Because if we take the whole structure from World War II, they had a great challenge because the men went to war, so we had to teach the women how to build arms.
Right, exactly. Planes and munitions.
Yeah, ammunition and tanks and whatever. So this method, we all know how the war ended. This was not because you had bad arms. No, the arms you used, they helped us to invade and conquer and take back Europe. So these women were trained within months to do a task they were never trained for, and they did it extremely well.
Yeah.
So what if we would train healthcare people to do all their tasks that are related to this COVID, so we can have enough manpower to tend to all these patients.
Yeah. There's history where even during the Second World War, there are nursing journal articles that were published just after the war, looking back at what had already been done, training new healthcare professionals.
Yes.
A lot of the women who then went into the factories created a need for backfilling and hiring in healthcare where they might have worked before.
Yes.
And there are 3 episodes going back in the Lean Blog interviews series about TWI for people who want to hear more about this. Episode 196 with Jim Hunsinger episode 202 with Patrick Graup, who's talking specifically about TWI in healthcare, and then episode 314 with Skip Stewart and Brandon Brown, who are talking about the application there. And further evidence of our aligned thought process, Arno. The follow-up question I was going to ask you about TWI was related to COVID, as you've already brought up. And, having to figure out how to do mass COVID vaccination. I've seen news reports. I've talked to one physician executive who's talking about the need to hire new people, or you've got medical students who maybe haven't given an injection before. And I think there is such an opportunity for TWI to train people quickly and effectively and consistently.
Yeah, exactly.
Through TWI.
Yeah, it is. And but what people in healthcare need to do is get rid of the idea that healthcare is so special that they have to figure it out all on their own.
In terms of training methods and management.
In terms of any method outside their own realm.
Mm-hmm.
I'm not saying that we should tell nurses how to, but how to train another nurse on how to put in an IV. Mm-hmm. There's a world's best method and it's not used. Mm. So I think that would be such a huge opportunity.
Yes.
Especially because now we take so much time to figure things out that young nurses, they get overburdened before they get to the point where they start understanding what the true work is. Yeah. In the Netherlands, there's double-digit numbers of people who want to leave the sector. Yeah. And that's a huge problem. Whereas if we could help them get trained so they can do only what they need to do instead of figuring everything out and running around. And I mean, I was working in a public health organization just last year, 2020. And what I did is I helped some of the doctors there to figure out where their time went. So, and then I had them color their time. And so green time was everything which was directly related to helping patients. Mm-hmm. And then yellow time was everything that is required by law or by their profession or whatever to make sure that we can tend to these patients. Mm-hmm. And then you can think of stuff like things you need to do for privacy or maybe the electronic medical records, those kind of things, but also education, which is also necessary. You need to educate the doctors so they can help the patients. And then we had red time. That's everything which is waste. Yeah. So waiting, computers not working, managing things. So the doctors were managing a lot of things, like when patients didn't show up, the doctor had to call the patients for a new appointment or whatever. So now for you, but you're although you were not in the product, you may be too much of an insider, but now maybe you can tell me how much of their time was red and how much of the time was yellow and how much of the time was green.
For the doctors?
For the doctors, yes.
I would guess only 30% of their time was green.
Yeah, if they were lucky. They had 25%.
Okay. So I almost said 25%, but you're right. My guess was an educated guess because I've seen studies that show in nursing that green time is very consistently 30 to 35%.
Exactly.
I've seen it through some of my own studies that I've done similarly with nurses. But yeah, I mean, that's so unfortunate and that leads to frustration and burnout with the
Exactly.
doctors and
Yes,
the nurses.
but it also tells you that there's no point in hiring more doctors
Yeah. Well, let's make
because,
better use.
yes, I mean, we could triple their productivity
Mhm.
and they could still do stuff that wasn't for the patient. So,
And they wouldn't be overburdened.
no, exactly. Because that was the biggest problem. Because one of the problems was that they felt staff shortages.
Hmm.
Yes, of course, because you can, if you're only 25% of the time working for your patients, you can see only so many patients.
Yeah.
Yeah. So,
Yes, there's a clear need and a clear benefit. And it
yeah.
just goes to show, again, how similar things are between an American hospital, a Canadian hospital, a Dutch
Yeah.
hospital. Yeah.
Yes. What I figured out is if you look uh, to hospitals, they're the same everywhere around the world and everywhere the last 200 years. So they're all siloed and everybody's very specialized in one particular task. So, so that's also maybe the problem. We don't know that there's another way.
Right.
So we think this is it. We have done it always like this, and we are healthcare, so we do what's best for patients.
Well, and we can help them really fulfill that promise. Or
Yeah,
that
I guess.
goal. Yeah.
Yeah, we could. So I hope that maybe some healthcare leaders are listening and they are willing to give it a try. I don't know, read my book or make an appointment, call me, uh, because if I can help you in any way to see how much the opportunity is and how little time it can take to help your team be more productive, we need it more than ever, I would say.
I agree. I agree. So, our guest today has been Arnaud Aurelio. The book is Lean Thinking for Emerging Healthcare Leaders in the US. It's available through Amazon. In Europe, so if people want to buy the Dutch version or the English version, where do you recommend people do that in Europe?
Yeah, so it depends a bit on where you're at. So for the Dutch version of the book, you can go to either my website, and that's called mensenbetermaken.nl. So that's for people who speak Dutch. They can figure that out.
Yeah.
Or they can buy it at the Dutch online stores.
Mhm.
For the English book, it's a little bit more complex. The easiest way, if you're anywhere in the world except for the Netherlands, then you can either go to Amazon or you can go to my publisher's website. They're called businessexpertpress.com, and there you can buy a book from anywhere in the world because they have all kind of publishing partners in Southeast Asia and in the UK. And for people who are in the Netherlands and want to get the English book, they can either get it by sending me an email, or they can go to any online store we have in the Netherlands, like Bol or Management Book. Or so.
Okay.
I guess that's the details about how to get the book.
Okay. And then do you have a website in English?
Yes, I do, and that's where you can send. So it's called Lean Thinking in Healthcare.com, and on that website you can buy my book because it's directly linked to the publisher's website. You can subscribe to my blog, so then you're sure that anytime I provide new content, you will get it. And you can, if you like, and if you need, I offer anybody in healthcare who is trying to change something, a free strategy call for 30 minutes. And in that call, I will assure you that you will have figured out what you can do next. And that can be anything depending on the problem you or the issues you have. So it can be either in your personal development, or it can be some process problem. Whatever you think is useful for you, just make an appointment, and I try to help you.
All right. So again, that's leanthinkinginhealthcare.com. Our guest has been Arnout Orelio. Thank you so much, Arnout. I really enjoyed being able to talk with you. Let's do this again, maybe later this year. If there's a different topic you want to take a deeper dive into, let's do that.
Yeah, sure. Thank you so much for the opportunity. Who knows? I'm trying to, my first Dutch book, I'm trying to translate it in English currently. So maybe I'm quick enough to present it in your podcast somewhere later this year. If not, maybe we come with another topic. Keep in touch.
Okay, that would be great. Okay, be well, Arnout.
Yeah.
Thank you very much.